Hi there, I'm Keith Lee, and I have exciting news for you. My business, American Retail Supply, was named the best small business to work for in Washington State by Washington CEO magazine. But why is that exciting for you? I've since sold that business, and now I work exclusively with dentists, showing them how to become a best business to work for. In this short video, you'll get an introduction to a new management system that you'll be using in your office. I can guess what you're thinking right now. Doc has been to another seminar, and here we go again. I'll just smile and nod my head and look like I think this is the best thing since sliced bread, but this too will pass. Well, this is much more than that. You know the value of your dentist's time, and your dentist has already invested a significant amount of time in this. So I'm pretty darn sure this is going to be permanent change that you're going to love. The system was developed by me. It's called the Make You Happy Performance Management System because it makes patients happy, it makes the dentist happy, and it makes you happy. Shortly after developing my performance management system, my wife, Patty, and I had a friend over for dinner. That's not us. We're older than that. My wife had told the friend that I'd been in Florida and Michigan giving presentations on my system, so she said, "Tell me about this management stuff you're doing." She was retired from Boeing, and I knew they did performance reviews, so I asked, "When you were at Boeing, you had performance reviews, right?" She rolled her eyes and said yes. I asked, "What did you think of them?" She replied, "They sucked." Now, you need to understand that Mary is one of those people who wouldn't say the S word if she had a mouthful. So I knew I had the title for my first book on performance management. Performance Reviews Suck. I speak to a lot of groups, and I often ask, how many of you have been on the giving or receiving end of a performance review? Most of the people in the room raise their hand. Then I ask, how many of you like performance reviews, think they're motivating, and that they lead to the results the organization wants? Once in a while, a hand or two will go up, but most often no one raises their hand. Shortly, you'll discover why performance reviews not only suck, but are counterproductive, and then I'll introduce you to personal development interviews, PDIs. If you have an office manager and you report primarily to the office manager in your office, it may be appropriate for you to replace her or his name with the dentist as we go along. When I say dentist, you may want to think of the office manager instead, if that's the person you report to. Just listen to what they're called: performance review or a personal development interview. If you're on the receiving end, which would you prefer, being reviewed in hindsight or being developed? What if you're the dentist? Which would you prefer to do, review someone in hindsight or develop them? Which would be more rewarding and get better results, reviewing someone or developing them? I only work with dentists that are dedicated to developing their staff. Performance reviews are like trying to drive your car by looking in the rearview mirror. As a parent of a teenager, can you imagine getting the performance you want from your child by having an annual performance review? Would every 6 months work? How about quarterly? But you may be wondering if you really need performance management system and what this means for you. Think of it this way. Let's imagine that you're driving a car and you want to be 50 miles down the road in 1 hour. It's important that you be there at a specific time, and you can't go above the 55-mile-an-hour speed limit. There are no other detriments. All you have to do is drive. Your car is mechanically sound. You get in the car and you start to drive. You can do that. It's easy, right? All you have to do is average between 50 and 55 miles an hour, and you'll be there on time. Now, let's assume that before you start the trip, someone gets in the car, takes out the speedometer and the odometer, and you don't have a watch. They remove the radio and they take down all the signs along the way. They've taken away your feedback system, and you know that this road is notorious for having the most effective speed traps anywhere. Now, how do you feel? Do you feel the anxiety and the frustration? That's the same frustration you feel when the dentist says, go get those goals, but with no supporting system in place to make sure you're getting the feedback and taking the necessary action to help you get there. Most dental practices are just like any other business. The management system, whether formal or not, focuses on catching people doing things wrong. Catching people doing things wrong is called management by exception. When businesses utilize management by exception, they're watching for people to do things incorrectly. As a result, they stymie creativity in the organization. If every time I do something wrong, the boss catches me, but he doesn't catch me when I do things right, then I fail to take steps out in front and really help the organization grow by using my creativity. When employed properly, an effective performance management system permeates the practice with a philosophy of catching people doing things right. When we start catching people doing things right, we encourage empowerment. People start to do things in the practice. Productivity improves on an ongoing basis. And the improvement doesn't just come from the dentist or the office manager, but from the staff and the dentist interacting with each other. People are picking each other up. The practice is flooded with a motivating environment. The second benefit that comes as a result of an effective performance management system is that you create a learning organization in which people are working together. Researchers tell us that as we move forward, people are going to stay with organizations where they have an opportunity to grow and learn. Management in many businesses is described as cops, naysayers, devil's advocates, or slave drivers. That's the old style of management, and it didn't work well then, and it certainly doesn't work today. Today, in new systems, your manager is a coach, a facilitator, a developer, a motivator, and a counselor. I've worked with business owners in more than 67 different business categories, and I can tell you your dentist has one of the hardest jobs there is. Not only does he or she do the job, treat and care for patients, but he or she is also the CEO of the business. Very few CEOs are responsible for doing the work and managing the business. On top of that, they didn't have a single management class in dental school. I hear it all the time from dentists I work with. The stuff I learned in dental school was easy. It's the management stuff I need help with. We talked about this a bit earlier. The key to an effective management system is having an effective feedback system. You will each have goals and objectives, but it doesn't stop there. That would be like driving those 50 miles with no feedback system. You and the dentist will create strategies and tactics that will help you achieve your goals. You'll meet with the dentist or your manager at least once a month so that they can get the feedback on those goals and the dentist can help you accomplish them. It's a complete system. You use this type of system every day. When you drive to a morning meeting, you use this system. You set a goal of getting to the meeting on time. You develop strategies and tactics. You get to bed on time. You set your alarm to be ready to leave by a certain time. You determine the route. You get feedback from your speedometer and your odometer and your watch. If you think you're going to be late, you step on the gas to get back on target. It's an effective performance feedback system, and we utilize it every day, all of us. When we don't employ it completely, we don't have an effective system, and then we're subject to the environment as to whether we achieve our goals. Everyone will have goals with effective feedback, and there will be adjustment along the way. PDIs are regularly scheduled and held weekly, every other week, or at least monthly. In areas where we have a lot of opportunity and want to see a lot of change, or there's lots of room for improvement, you'll have them more often. In other areas that are very much under control, you'll have them less often. Your PDI is your opportunity to brag. As we start these PDIs, you and your dentist will create specific objectives for yourself. The objectives you create for yourself are every bit as important as those the dentist creates. The objective will be focused on two areas: those that help you to become the very best at your job that you can be, and those that improve the practice. So what do these personal development interviews look like? To start with, they're not scary at all. The whole purpose is to develop you to become the best you can be at your job. Remember, these are one of the main reasons my business was named the best small business to work for in Washington State. Every personal development interview includes these 5 questions. What has gone well since we last met? Since we last met, what did you identify that we could do to improve the patient experience or improve our practice? Since we last met, what did you find that was broken or could be improved, and what did you do to fix or improve it? Since we last met, what did you do to create a motivating environment by catching someone else doing something well? And finally, what else would you like to talk about? In addition to these questions, you'll be reporting on the progress you made towards your objectives. As you can see, your dentist or manager wants your input. The first question is, what has gone well since we last met? We always want to start the personal development interview with something that has gone well. The second question is, since we last met, what did you identify that we could do to improve our patient experience and improve the practice? I'm not going to tell you that the patient is always right, but I will tell you that there is only one boss, and whether you're the cleaning lady or the dentist, the boss remains the same. It's the patient. She is the person who pays everyone's salary and who decides whether a practice is going to succeed or fail. And she doesn't care if the practice has been around for 100 years. The minute it starts treating her badly or taking her for granted, she'll put it out of business. The boss, the patient, has bought and will buy everything you have or will have. She's bought all of your clothes, your home, your car, pays for your children's education and your vacations. She pays for all of your bills, and she pays in exact proportion to the way you treat her. The lady who works in the most lavish of practices might think that she works for the dentist who writes the paycheck, but she doesn't. She is working for the person who pays everyone's salary. In fact, the patient can fire everyone in the practice from the dentist on down, and she can do it by simply spending her money somewhere else. Some of the largest practices that had flourishing businesses a few years ago are no longer in existence. They couldn't or didn't satisfy the patient. They forgot who the boss really is. We want to continually focus on improving that patient experience. The third question is, since we last met, what did you find that was broken or could be improved, and what did you do to fix or improve it? We want to find things that can be improved so we can improve them, and we certainly don't want to hide things that are broken. If we hide them, they stay broken, and that makes your job less enjoyable. We want to fix things. Since we last met, what did you do to create a motivating environment by catching someone doing something right? We want everyone to be looking for the positive. This doesn't need to be some earth-shattering thing you did to make someone's day better, but we want to all be picking each other up. Finally, what else would you like to talk about? Your manager, whether it's a dentist or someone else, wants to know what's on your mind. We know that you won't always have something to report on each of these, but we want to make sure you're always looking to improve the practice and your position. You'll have an activity log. You'll jot notes to remind yourself of what you've accomplished in each area. As I said, in addition to those 5 questions, you'll report on other things that you want to learn or improve on, or things that you want to accomplish. Here are some examples of activities for a hygienist. Action taken since we last met to create the documentation and preparations for prescription supervision. What I did since we last met to create a scaling, route, and planing protocol with insurance documentation. Action taken since we last met to create a script for office tours. Action taken since we last met to create the documentation and preparations for prescription supervision. Here's some examples for an assistant. Action taken since we last met to create protocol for instrument passing. Action taken since we last met to create protocol for emergency drug preparedness. Action taken since we last met to create tray stocking protocol for ops. Action taken since we last met to create protocol for topical anesthesia. Here are some examples for the front desk. Action taken since we last met to improve our tropical beach theme to be the most inviting, comfortable, and calming experience of any dentist's office anywhere. Action taken since we last met to create a checklist of what needs to be done each month and assign the duties in the checklist to individual staff members. What I did since we last met to create the protocol for paying bills and recording invoices. What I did since we last met to create an office tour script. Your dentist has taken a firm commitment in time and money to develop you, to help you grow. The dentist or your manager will be meeting with you shortly. Think about the things you would like to see done in the practice to improve both the practice and your job performance and your enjoyment. What things could you be better at? What would you like to learn? What would you like to see changed? Remember, this is all about and for you.